Hi, everyone. Welcome. Thank you for joining us. We're here tonight for Navigating COVID and Trauma, conversation on boundaries, healing, and community care with myself, Emil, Michael Munson, and Caleb from Forge. So I want to take a moment and just say welcome again. We are really glad that you're here, both in this webinar live with us, sharing in the chat, or just listening. We're glad you're here for those of you who are watching the recording later on at your own time and pace. And we're glad you're in this world too, not just here with us, but super excited that you exist. So thank you for that. Today, we're talking about COVID and we're talking about trauma. We have kind of a rough agenda for this conversation, which is starting with COVID still here, a little bit of background information on just like the state of the world. Then talking about navigating the world as COVID cautious people, which I believe all of us identify as. And then that intersection of COVID and trauma, and thinking about risk assessments, relationships, boundaries, and connection, kind of all the things that both COVID and trauma have big impacts on in our lives. And then we'll close. Throughout, we do have a lot of chat prompts for y'all to get conversation going. You're also welcome to share throughout whether we've asked a question or not, respond to what we're saying, bring up your own questions. We will try to read out some of the chat answers. I don't know if we'll get time for all of them. Feel free to be so boisterous in the chat that we can't read everything out loud because of time. We will, to respect your privacy, we will try to refrain from using names when we say, so-and-so said. We'll just say a chat comment says, but we do see you and honor that it comes from you. But because this is recorded, we want to respect your privacy. Any names can be edited out post-recording, and you're welcome. I think your names in the chat won't show up in the post-recording. So you have privacy that way, but feel free to share as much or as little as feels comfortable. And you can also chat just directly to the host and panelists or one of us throughout. And let me make sure I covered all of our kind of background stuff. Recording. Let's introduce the Forge team. How about, I'm Emil. I use they, them pronouns. I'm program manager. I've been at Forge 2 years now and come from domestic violence work and prevention work before that for a very long time. And I live in a state that doesn't really believe that COVID is a thing and has aggressively tried some COVID denialism. And I'm also in a, pretty rural area. So I have a lot of, those two things are going to really influence what I share today. Michael, do you want to introduce yourself next?
Sure, cool. Thank you, Emil. I'm Michael Munson. I use he, they pronouns. I am the executive director of Forge, and I've been here for 30 years. So we have the youngest, the shortest duration, and the longest duration here on the call. I'm really happy to be with you all today. I am in a large city in the Midwest, and I tend to think that the whole country is not very COVID in tune anymore. So I live in a blue state that's depends on where you go and what people think about COVID from person to person. Caleb, you want to go next?
Yeah, I'm Caleb. I use he, him pronouns. I'm Forge's communications coordinator. I've been with Forge since 2019, I think, so however many years that is now. I also live in a blue state on the West Coast in a major city. And so we have had COVID protections. We did for a long time after a lot of other areas dropped theirs. Now that's not so much the case. And socially, culturally, there's some difference in there are COVID cautious events and I'm meeting people and connecting, which is amazing. And there's not a lot of policy level support. So it's a little bit of both.
Thank you both. And for y'all, again, welcome. If you feel comfortable sharing your name and pronouns in the chat, can be just first name or skip that part. We'd love to hear where you are, however specific you want to be about that, and something pretty you can see right now, because I feel like we need some glamour in our lives. I can see this cat that has a very gorgeous, gigantic, fluffy tail. Hopefully he'll make an appearance on screen at some point. Hundreds of books. Oh my gosh, books are so beautiful. Thank you. Shout out plug. We posted a blog about the trans readathon, which is happening right now. So if you want to hear us nerd out about books, you can check out our blog. Welcome everyone. Trees, jar of isopods. Love it. As you're sharing, just want to invite everybody to remember to take care of yourselves throughout this webinar. It is recorded. We do love engagement, but we also love the kind of engagement that is, more internal. So if that's getting cozy and covering your eyes and just listening, that's great. If it's reading the chat, that's great. If it's logging off and watching the video later, that's great. Whatever works for you. And again, share, as works for you. We've got lots of spring flowers coming in the chat, sleepy kittens, sun shining, beautiful comfort objects. Thank you. If this gets stressful at any point, I invite you to look back at that beautiful thing or scroll up here and check out the beautiful things other people shared as one source of comfort. So I am going to jump right into the where are we now stuff. This is an extremely short presentation about COVID, which I was sharing. I was listening to the start of a 4-hour long podcast about COVID. And that's probably not enough. They kept being like, we don't have time to talk about this. We don't have time to talk about this. So there's a lot more to say than we're saying here. But basically, COVID is still here. It still causes death, long-term health impacts, and acute infection, and it's still highly contagious. This is an example of a wastewater map, which is one way that people are currently measuring COVID levels is through how COVID passes into through our systems and into wastewater, and then you can measure it there. To measure stuff like that, we need a robust public health system. We need infrastructure to actually take these tests and then report them to somebody who can analyze them all together. And we have increasingly less robust infrastructures. But the People's CDC is one organization that's still regularly publishing COVID information. So this is from March 6th, and the darker colors indicate where there are higher levels, and the lighter colors indicate lower levels. And the gray, there's one gray state, is where there's no data available. So that's one way to tell that COVID's still around. There's been changes over the years of how much death there is from COVID, how acute infections impact us, all those things, and it varies based on individual and vaccine levels and a lot of stuff. But the basic layout is it's still here and it's still very impactful on people's lives. And throughout the pandemic, we've seen just massive health disparities. This has been really, really racialized due to a lot of things, racism in the health system, racism in the ecosystem that leads to less access to care, to less safe environments. So those disparities have been in acute COVID infections, in ICU admissions, death from COVID and COVID-related impacts, the long-term impacts of COVID and long-term COVID, economic impacts like losing jobs and housing, other financial stress, mental health impacts, and pretty much everything that you see. There are going to be these massive racial disparities in. So we really hold that as a part of what's impacted all of our lives over the past 5 years and everyone else's. We also, so I'm not talking about trans disparities yet, sorry. We also want to frame what long COVID is. So I mentioned that there are long-term impacts to COVID. Long COVID is a term that describes long-term symptoms following an infection of COVID. Not everybody's been able to verify if they've had an infection or not. But since 2020, since the very first COVID infections, people have had long COVID. Typically, it's measured by if your symptoms continue at least 6 weeks post-infection. And those don't have to be the same symptoms that you had when you had COVID. So some of the most common ones that people are talking about are post-orthostatic tachycardia syndrome, or POTS, ME/CFS, which is a big long word that even though I don't ever remember, chronic fatigue syndrome, but it's the technical term for chronic fatigue syndrome. Mast cell activation syndrome, brain fog, memory challenges, and so much more. All sorts of like weird and new and different health stuff are happening. And Long COVID Justice is one of many organizations that are doing work to improve care and coordination for long COVID. So this is an image that they've shared. Yeah, and I think I just shared in that I have long COVID that has severely impacted my life. I'm sure I will talk about it more, but so I'm sharing that from the perspective of someone with this. And I'm not alone in that, because trans people have way higher rates of long COVID than cisgender people do. On this chart, it's not all the way up to date. It's from June 2022 to February 2024. It's long COVID percentages. So the red line is cisgender men, the blue is cisgender women, and then transgender, and all trans folks are lumped together in this chart because of the way they did the data. But you can see the green is like spiking up a lot more than the other two. We have a bunch of resources we'll send you out after this, but there are articles showing the disparities in both getting acute COVID and then long COVID, particular to trans people. And that's linked to, a lot of things, health disparities in general, stress, the economic situation, who's more likely to get COVID because they have to keep going to work, or all these different things that, again, there's a lot of information about, and also not enough information about. And then kind of our final background piece that we want to share is that there's been a lot of challenges to care over the past 5 years. And these are some of the ones that we're facing right now. Pandemic denial. We hear a lot of people saying things like the pandemic's over or COVID's no big deal. So that all of those things fall into pandemic denial, the idea that we don't need to care about this anymore. Lack of vaccine and testing access. And this has gone up and down throughout the pandemic. Again, there are massive disparities in who has had access to vaccines and when they've had them, who has access to testing and when they have them. There are some places where free tests are still available. There are a lot of places that are not. Lack of universal healthcare and paid leave has been a major contributor to a lot of the negative impacts of COVID. People had to go back to work because they didn't have paid leave and were more at risk or had to work when contagious. Lack of universal healthcare has severely impacted people's economic situation or made them not get healthcare that they needed. We're currently in a heightened moment of defunding research into vaccines and COVID and long COVID. And that's not just COVID vaccines, but all vaccines. So that's going to have huge impacts going forward. We're also seeing an increasing number of mask bans or attempted mask bans, saying that you're not allowed to wear masks in public. And we again know that some people will be more targeted for arrest or harassment for wearing masks than others. And then removal of information on long COVID from government websites. It's not the only thing being removed by any means, but it is a huge loss to resources when we aren't able to look up what's happening with long COVID anymore. pause the slides there. And with that background information, I'm going to just invite all of us, Caleb and Michael and myself, to give a little bit more intro on like how you've been navigating the COVID world. Caleb, do you want to get us started?
Sure. Thank you for all that background, Emil. Um, for me, COVID started while I was in college, so that kind of threw everything into disarray. Around that time, I started to struggle with chronic health issues more intensely, and I don't know for sure if that's a long COVID thing. I've never had a positive test, but I think it's likely that I had it at some point without knowing. Um, Around that time, so everybody on my college campus went home for a while, everyone who could. And then later I moved back to campus in the area. And I was living in this bubble, I think, where my college's policies were pretty supportive, where we had mask requirements and pretty extensive testing for folks coming back and virtual classes and all these accessibility tools that like have been there but were not in use and now are no longer in use anymore. So those policies went away, and I saw more and more people my age who were in college and wanting to explore and wanting to party and do all these fun things, kind of return to normal, which did not feel like an option to me. So I've lost connections with a lot of those people that I was very close with at the time. And that's been an ongoing theme. I'm guessing a lot of people have had similar experiences with like having very different precautions from people in our lives. Um, I feel really lucky and privileged that I work from home now, so I'm not in environments at work where I'm being exposed to people all the time. I don't have to wear a mask at work, which is really nice. Um, I live with a COVID cautious roommate, which has been super helpful. In the past, I've lived with people who were much less cautious than me, and that being a kind of constant stressor. So I'm really grateful for that. And then I'm also, like I said, living in a major city where we have a lot of COVID cautious events. Finding social connections is still hard, but I'm like so happy to be able to go to events regularly and be around people who are wearing masks and share similar values and having that sense of local community. That's just been so important in my experience.
Um, Emil, do you want to go next or?
No, you go.
All right, cool. So it was interesting listening, Caleb, to you talk about like, kind of where you were in 2020 and one of the things that was happening for me when the pandemic first started, and this is going to sound a little bit twisted, but as somebody who's always been interested in public health, it's like, wow, this is really interesting. It's horrible, but I was really fascinated by both the public health response and just the amazingness of like how a virus can spread so quickly and so powerfully. So aside from my curiosity of that, the rest of it was really horrible. Um, I've been somebody that has always been really fascinated by public health crises. Again, I know that sounds kind of weird. And I've always been somebody that has lived kind of on the more cautious side of things. So, like in terms of HIV, in terms of STIs, I'm somebody that always kind of leans towards the more conservative or the more restricted or constricted in terms of my own level of comfort and risk taking. So I think that was a really good blessing for me of like coming into this kind of approaching it with uh, a more hesitant, more cautious, more I would like to take precautions, and I would like everybody else around me to take precautions. So it was an interesting framework to kind of come from. I'm immunocompromised, so as things were starting in the early days, early years, I was really aware of the fact that I was at possibly heightened risk of more serious health conditions if I had COVID or if I developed long COVID, which I do not think I have developed, but I think sometimes there's a slippery slope. Caleb, you talked about kind of COVID privilege, and I think that's a really important thing for us to talk about because, like you, everybody at Forge works from our home spaces. Um, I do not have to wear a mask at home. I can be as free as I need to be in my own 4 walls or however many walls are in my house. And I live in a house. I don't live in an apartment building where I have to like use a public elevator and walk past people all the time. And one of the things when I was thinking about today was about like how there's so many things that started for me and for my family in 2020 that we still continue, which is doing things like buying groceries and having them delivered. I know that's a privilege that a lot of people can't afford, or it's not convenient, or lots of different things. But there are some things like that that are really, really a privilege for me. Um, and one of the other things I was thinking about is that I'm really introverted, so I think that's kind of a privilege to be introverted because like I am fine not interacting with the world, which has probably been really effective in helping keep me and the people around me who I do socialize with safer in the long run. Emil?
I put in the chat, but I'll say it out loud for anyone who missed it. We'd love to hear from y'all what brings you here today too. And I'll share out some of those in just a minute. I've said this before, if y'all have heard me talk, that like I didn't actually believe extroverts were real until the pandemic. Like I just thought people were lying about how much they liked other people. And then I saw my friends like really, really not being okay. And I was like, oh, oh, you were serious about that. So I'm obviously also an introvert. And this idea of COVID privileges came from a workshop Caleb and I went to, led by Isa and Cheris at Creating Change, that was about COVID cautious folks, and they had us introduce ourselves with that. And I really like it because it helps me. I mean, I think it's important to think about the ways that we do have privilege as well as the ways that we experience marginalization and oppression. And I also think it's helpful to think about our strengths and resources too. And so that COVID privileges conversation has been helpful there. So, living in a rural area, I can go outside and not see anybody, like not go anywhere near people. So, very, very different than living in a city ever, but especially during like early COVID years. And I have, people close in my life who are very like science literate and could explain research papers and tell me the history of how vaccines get developed, which could help me, make good decisions that felt good for me and stuff like that. And I've also like spent a lot of time adjacent to or in or around or learning from disability justice communities, which I think was super helpful for thinking about how we take care of each other. And also for when I got long COVID, having some basis of tools to like be start being more okay with the fact that I could do like a quarter of what I used to be able to do with that. And that's a huge change. And really like having the tools to disconnect my self-worth from my productivity is thanks a lot to those communities. That's going to be my quick background. And I see we've got a lot of folks here. I hope y'all are able to read through the chat and take time with it. But people running mask blocks, people who are working in community organizations and want to increase their COVID cautiousness or have accessibility policies. People are here to just have community and connection with other folks. Definitely a few polyamorous folks here. And I think we'll probably get into that a bit more in the relationship section. And yeah, a lot of folks sharing concerns about either having long COVID themselves, being immunocompromised, and those struggles. So thank you all. Keep sharing that. So we're gonna now talk a little bit about trauma and COVID. And I guess the background, I'm used to having a slide whenever I talk about trauma, but like, trauma is so many things. It's the stuff that like makes a major impact on our lives and really our sense of selves, our sense of connection to others, and our sense of the world. And it often disrupts those connections in a lot of ways. It can be an act of violence. It can be, a one-time event or a long ongoing situation. So I don't know if y'all can hear the background noise. It's just my dog. She's just knocking things off the counter. It is fine. Uh, um, so the pandemic was traumatic for a bazillion reasons. People lost loved ones, people in our lives. Um, Even if you didn't lose someone directly, we're in a world where there was massive amounts of death. Um, I know, like talking to people in New York or like anyone from New York who's ever written anything talks about the sirens and how the sirens are constant. Like that's a sign of this long-term impact on us. Um, so we know that COVID can be traumatizing. It can be isolating. We're afraid. We're getting lots of different information from different places and don't necessarily have control over our own lives um, or as much control as we want. In addition, COVID exacerbated other types of trauma. A major one that we saw impacts on was intimate partner violence. So because people were often stuck at home or more isolated, we saw much higher rates of intimate partner violence being reported and people having way fewer accesses for help and resources. Shelters weren't taking people in, people didn't want to or weren't safe to go to them. There weren't other options. So we saw the ways that COVID like exacerbated a lot of other conditions and made them worse. So what we want to talk about is really how this intersection, right? Trauma impacts our experience of the pandemic. It intersects with our COVID precautions and our sense of agency and self and how we can respond to the pandemic. And then the pandemic can increase trauma responses. So Michael or Caleb, which of you wants to start with some stories about that?
You want to start, Caleb?
Oh, I can start. Um, yeah, I was thinking one of the ways that this has shown up for me, I think, is in being in public spaces and kind of that emotional experience, especially as, you know, living in a place where we had mask mandates for a while and then they were dropped and seeing more and more people be unmasked in public. That was kind of a change. And like, I felt so much fear and anger when I was in public. I had this just very visceral response in my body and my nervous system to encountering people who were not taking precautions. And in my mind, which I think a lot of this comes from transness too, there was this visual reminder of I perceived people going, I don't care about your safety. I'm not willing to take care of my community. That felt very personal and painful. Um, Unfortunately, that's kind of continued to be the reality that most people are not masking. And so it's something I've had to work on the emotional regulation side of can I be okay in those spaces and feel those things and not be totally overwhelmed by them. Um, Part of that has been like balancing that hypervigilance, I would say, that I was feeling with tuning things out. And I've had a couple of experiences where I wasn't aware that I was with family at one point, and one of my family members told me that people were laughing at us for wearing masks, and I was completely unaware that that was happening. Um, I think I, for my own safety, ignore that stuff, which then can be unsafe sometimes. So trying to find that balance between those things. The other thing I've been thinking about with trauma and COVID is around relationship building and how it can feel so high stakes and like there's so much scarcity around connecting with people in this small community. And reminding myself of the choice that I do have and that I can say no. I think I worry a lot about like if I don't connect with this person, that just like, am I never going to find another connection that feels important to me? That's not really the case, but it can really feel that way. Um, None of these things are like solved. For me, these are very ongoing things that I feel like I've learned a lot about myself, and I'm continually learning to like tell myself a different story about my safety and being able to connect with people.
I wanted to take a moment. I see that some people in the chat said that they couldn't hear, and I just want to make sure that we've got, it looks like sound is back for most people. Um, so if that's not true, can you pop in the chat that it's not true, and we'll see what we can do to figure that out. Great, cool. Emil, do you want to go next? Okay, cool. So when I think about like this intersection between trauma and COVID, it's hard for me to disentangle personal from theoretical sometimes. So you're gonna get a little personal blip here. One of the things that I continue to hear, and a lot of us continue to hear, is things like, hey, what's the big deal? Like, what's the big deal about wearing a mask? It's really simple. And I agree that that phrase feels right to me. And for me and my body, with my medical history, my medical reality, as well as my trauma reality, it is a big deal to wear masks, which puts me in a really weird spot because I want to care for my community. I want to do lots of things that that mask wearers do. Um, and there's a reality that my body does not comply, doesn't do what I want it to do, which is just what I have to work with. So just to give you a couple of examples, because I think that a lot of us have heard over the years, like, oh, like I can't wear a mask because of, and then they find lots of reasons to spout it. And it's used as more of an excuse than a reality. So some of the realities for me are that like I can't regulate my temperature very well. So when I wear a mask, I get really hot because I can't breathe as well. And I will feel like really faint, like I'm gonna pass out. So if I'm sitting down, I can wear a mask. But if I have to like walk through the airport or go, I don't go to the grocery store, but like if I went somewhere, it'd be really difficult for me to stay masked and just keep my body temperature regulated. Related to that whole body temperature regulation and feeling unbalanced sometimes, I really struggle with being dizzy or being off balance. And some people, Caleb's really good at this, can wear a mask and not have glasses fog up. At least I've seen you most of the time be able to be successful with that. I have never been able to be successful with that. So like, when I wear a mask, my glasses get fogged and there's no way for me to stand up and walk without me going, oh my God, like what can I do to be steady on my feet because of how my vision affects how I walk. So those are like a couple of physical realities that play a role for me in masking or not masking. And then kind of on a deeper, more personal level, some of the trauma that I've experienced relates to my face. And so like literally having something on my face can be really traumatic. Not all the time, but it's something that really can stir up a lot of emotions. With the on my face thing, I have multiple chemical sensitivities. A lot of the masks have sprayed in stuff. I don't know what they spray it with, but I can't tolerate it. So when I start breathing, if I wear a mask, um, whatever they're sprayed with, it feels really deadly to me, and it makes my breathing even harder, and it's just really tough. So those are some of the intersections just of like that simple thing around masking and why, even though I really, 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 really want to, that's something that I need to take into consideration when and if and how I interact with other people. Emil?
Thank you all. And thank you for everyone who's sharing, ideas and responses in the chat too. And I appreciate how y'all are having this conversation of figuring out what works for different people, knowing that like we have different bodies and different needs. If there are a lot of things I thought of about this question with trauma, and one is like something that we know about trauma is it really impacts our understanding of risk. And for some folks, it can make us really risk adverse. The world is dangerous. Everyone and everything is dangerous. And right, like there's a lot of things that we're right are absolutely dangerous. But trauma can make it hard to figure out like when you are right about that, or like when you're acting from a place that is like, this is my risk aversion due to trauma versus this is my risk aversion due to information versus this is my personality versus like all these other components. And we don't necessarily need to sort out which is which to decide what to do, but like there are times where we might isolate in ways that hurt us, because it's really, really hard to even consider taking a risk. And that might be something that we want to get supported on. On the other side, I also see a lot of folks who are like, you know, F it, like life is dangerous, bad things have happened to me, I don't care. And that may not be their exact words. I know at least a couple people who those are their exact words, but like our trauma response is we just kind of deny that risk exists and do a lot of like things, maybe because they give us thrill, maybe because we're not worried about our own safety anymore, maybe because we just, our brains like aren't processing data in the same way they used to. And so those two things, like when we're in community and we're coming from these different places, it can be really hard and complicated. And it can be hard to figure out where you go from there. I saw a lot of folks using the word like gaslit in the chat and talking about that. And that's definitely something I've experienced too, both with COVID precautions and long COVID, of being like, having to constantly be like, I'm not wrong. Just because I'm different from everyone else around me doesn't mean I'm wrong. And that's really exhausting to do. And I also wanted to just bring in like medical trauma too, of, we know like for trans folks, we've had a lot of crappy providers. Either we have directly, or we know people who have, or we don't have insurance, or we can't go to the doctor. Doctors have lied to us. Doctors have said, oh, this is probably because you're trans. I had a doctor tell me that my long COVID was because I drank Diet Coke before he even asked me if I drank Diet Coke. So like, it's wild out there. We don't know. And then we look at like systemically, the big medical system does not value trans lives, and it doesn't value the lives of people of color. And we've seen massive racism in access to care. We know that like pulse oximeters work better on white people because racism, and vaccines have been tested in cruel and effed up ways. And so there's like legit reasons to not trust the authorities. Um, and then we see things like the CDC, you know, pretty early on, 21, 22, was like, the economy wants people to go back to work, so we're going to change our guidance, even though we have no science to change our guidance. So like, we bring in this medical trauma and distrust of the system, which can make it really, really hard then to figure out what information can I trust, who do I trust, and why. Yeah, and so that all comes in with, added to the like, do I even trust myself because of all of my life experiences? And I see this word exhausting in the chat, and like, yeah, it's exhausting and it's hard. I just want to look through the chat. Michael or Caleb, did you see anything in the chat you want to highlight?
There's a lot of stuff, but it's really, really, really cool. I'm so appreciative of all of it. And it's going fast. And I haven't, so no, nothing to highlight, but I do hope that other people can read and listen at the same time.
I'm seeing this, a recent comment about just from someone who's very visibly trans and a brown person, and adding a mask on top of that, making them stand out. And I want to highlight that it kind of leads into our next question, is like, how, given all of this that we've just said, how are we taking precautions And I think I see your hand raised. Maybe do we have time for an unmute? Yeah, let's do. I'm gonna see if I can get you to unmute. Nope. Oh, it was unintentional. Never mind. Okay. Thanks. So thinking about like all of these intersections, let's look at how do we take precautions? What does that mean? Caleb, tell us all the answers. Just joke, y'all. We don't know how to.
Awesome. Well, this is great because something I'm reminded of so often is that being COVID cautious, if that's the language we use, there's a lot of different language, looks really different for different people. And like when the three of us have been together at conferences, we have different precautions that we take and like different ways of navigating and have conversations about that, about how to keep each other safe and how to feel safe. And that's been this ongoing theme of like when I meet new people in COVID cautious community, just that level of we're both COVID cautious can mean really drastically different things. Um, I think about COVID precautions as harm reduction. So we're most of the time going to be experiencing some level of risk, but all of the precautions we take can help reduce that risk, even if, not to use you as an example, Michael, but like if you're only able to mask in some settings or some of the time, that reduces your chance of exposure in those spaces. So if it's only the doctor's office, that's at least one place where you're less likely to be exposed or to expose someone else to this. Um, Kind of an analogy I think of with this is with abstinence only sex education, where sometimes it feels like the only options are totally avoid risks and have perfect precautions, which is pretty impossible. A lot of us are trying, but it's really hard. Or kind of throw away all of those precautions and take the risk anyway. um, I hear people talking about like, well, I can't wear a mask all the time, so why do it at all? Or like, I got sick while I was wearing a mask, so they don't work all the time. So I'm not going to take on that discomfort. It can be really uncomfortable. Um, and I'm just reading the chat too. Somebody mentioned the Swiss cheese method, which is what I'm going to talk about next. So that's amazing. Where every precaution we take is more protective than not taking precautions at all, even if none of them are perfect. Um, so for folks who haven't heard about it, the Swiss cheese analogy is where every Swiss cheese, every slice of Swiss cheese has holes in it, and every slice is a one precaution that you can take. And when you layer multiple slices on each other, the holes from one get covered by another, ideally. So like with vaccinations, that can be one layer of precaution where they can be really fantastic for reducing the severity of a COVID infection, not necessarily for preventing us from getting sick in the first place. So then we add a layer of wearing a mask in public that fits well and is high quality, and that reduces our exposure and chance of getting sick. So it covers some of those other holes. Um, Another piece of this is like we don't all have access to the same precautions. Um, some things are not going to be accessible for all of us or not possible. One of those other layers might be air filtration, having an air filter in a space. A lot of times we're in a public space, like that's not something we have control over, but we do have control over some of those layers. Um, and like folks have been mentioning too, when we're taking precautions and there are other folks in a space who can't, who have limitations, or like somebody can't get vaccinated, they can't wear a mask, our precautions can help keep other folks safe by just at least reducing by one person the chance of exposure. Um, so that's a lot of things. And I know all of us have different like levels of keeping up with information about precautions and are all making different assessments about risk and how we decide those things. So I'm curious if folks want to share, how do you make risk assessments? What helps you make decisions about taking on risk and reducing the harm. Yeah, that in the chat.
And Caleb, as we're waiting for people to come in, I was thinking about when we had a conversation the other day about like, where do you and me do different things, and they're each reducing our risks. And can I talk about the grocery store? So like, I don't go to the grocery store, and Caleb, I think you value going to the grocery store because I don't know, whatever. I mean, it gets you with people, it does whatever it is. And so like, you're able to mask and you go to the grocery store. I don't mask and I don't go to the grocery store. So like, there are two different ways of like, did I just say that right too? I think I might have just misspoken, but like there are two different ways of both of us reducing our risks, and they look very, very different. So, but they're still both in the same direction of risk reduction.
I'm seeing in the chat, it's like negotiation and conversations and a lot of examples of like, people will say an event is COVID cautious, but like, what does that mean? And so I find the like getting really concrete helpful. And I will talk to people about like, what, like tell me about the 2 weeks leading up to when we're hanging out. Because that information might make me make different decisions if somebody is going to a ton of concerts versus somebody is not leaving their house. We can make different decisions, but only with that information. So that's part of my risk assessment. I also think about another tool for risk assessment is like thinking about when and what people use their risks for. So, if we're layering on protections, we're doing what works for our bodies, but we also like, I know, the three of us we work from home. We are super lucky. And for folks who like go out and are exposed all of the time and around people all the time and they can't control what those other folks are doing, there may be a different set of calculations, and some of that might be I want a chance to have fun and joy in my life, and so I know some people who are doing more social stuff than I do who are at higher risk, and whether or not I agree with the decision, I can see the decision making process and being able to like, when we have a good enough relationship, this isn't going to be for like every stranger or the people who are jerks in your life or stuff like that, but like being able to talk through and hear through people's perspectives has been really helpful for me in doing the risk assessment with that individual person in that situation, and helps with some of that like that layer of trauma of it gets more specific and kind of gets underneath some of the defensiveness because you're listening to their actual decision making and not just their actions. Yeah. Caleb, did you see stuff in the chat we should add in?
Well, I just saw a comment about the challenge of like finding housemates who are have a similar level of precaution, and that's absolutely really difficult. That's been my experience too, of that's your living space, and it's really hard to have a different level of risk tolerance and exposure from somebody else than we're comfortable with. And somebody else says, yeah, so much of my COVID trauma is from roommates. Absolutely. Michael, are there other things you see here to highlight?
It's really fast. But one of the things that, I think I saw up in the list is kind of like different people in their family structure who may have different risks, and like we might love our family, we might want to go be with our family, and like what does that mean when we each have different risks? So it's a little bit like the roommate, but not quite. And those are tough things.
Yeah, I think those are places also where the communication can be really helpful if you're in the process of looking of kind of knowing beyond COVID cautious, like what does that mean for you? What are you looking for? And we're not always going to be able to get it because of economics and stuff. I'm also seeing like people doing their own tracking, PCR testing, resource sharing, that's a big thing we talked about this caucus Caleb and I went to, is, you know, having the one person who has the really fancy expensive test and can do group testing, you know, for everyone, figuring out when to do the high-end tests versus the cheap tests, things like that have been really helpful. And again, we will be sharing out resources. We've got, I think we've got links to some info about clean air clubs and mask blocks and stuff like that. But y'all, thank you so much for all the things you're sharing in this chat. The one other comment I'm thinking about is one person said, it's like, this is paraphrasing, so forgive me, but like being afraid, I still want to I still want to have joy. I want to have fun, but like going to this one event is not worth long COVID. Long COVID, this sucks. um, and like living without socializing is also not worth it. And I don't have an answer for that. Like, partly, I mean, we don't always know where we get stuff from, right? Sometimes it's obvious because you only did the one thing, but like COVID's just around. And so we may not be able to attribute it to that one fun thing, but like I think we'll be getting into that question actually kind of next. So next we want to talk about like the impacts of relationships. So you know, if Caleb or Michael or me want to bring in like this, how do we still stay connected to joy in relationships? How is COVID impacting relationships? Michael, you unmuted. You're
I
ready.
did unmute because I actually wanted to grab something what you just said, which is like, like sometimes we don't know where we get sick from, or you didn't quite say that, but like we don't always know our vectors. Like right now, my partner is sick, not with COVID, but like we are pretty homebodied. Like we don't always know where we might have those risks coming in. So like even if we take a lot of precautions, we don't always know. We can't 100% trace back to who might have infected us, and sometimes it doesn't really matter. I mean, if we're living our life in a way that we feel is as safe as possible. So that was the one little thread. Since I'm unmuted, let me just share a little bit, and then y'all can share. One of the things that I really missed in the early COVID years was the breakfast that I used to have with this one person who were kind of BFFs. We would go and have breakfast, I don't know, maybe once or so a month, not that often, but it was so, so, so valuable to me, and I think to her as well. And we are both like really physical people, and I really really missed early on like the physicality of touching people, hugging people, even though I'm introverted. And so this friend and I would like sit and hold hands and have breakfast, and then it stopped, like really abruptly, in at the beginning of COVID. And we have now since had breakfast a couple of times, but I'm still not thrilled about going to restaurants. It's like we're trying to figure out how can we have that meaningful connection that feeds us both, not literally just breakfast, but feeds our emotions and our desire to physically be connected to each other. And we haven't figured it out yet, but it's one of those things that we care about, and it's slow. It's a slow kind of unfolding of things. Yeah.
Well, I can jump in a little bit here. Michael called me out earlier about going to the grocery store, which is great actually, because I could order groceries, and I have at some points, but I also go in person to the grocery store most of the time. And I know it sounds weird, but for me, because I work from home and spend so much time in my apartment, I need to be out of there. I spend as much time outside as I can, but doing those kind of in-person things, even though it's not like the most fun ever, I like go and talk to the person who's checking out my food, and I like have this experience of being around other people. Um, and for my social anxiety, it's been really important to not be in isolation so much of the time. Um, Most of the time, though, I'm trying to find specifically COVID cautious people and events and connections, which I know is not an option for so many people in different areas. I felt really lucky to be able to go to a song circle that's all masked. I'm like, I love singing with other people, and it like makes me so happy to be in that space. And in my area, we've had some like friend specific events, like can meet new friends, because there are so many people who are isolated who just don't really have that opportunity to build new relationships. Um, it definitely, COVID has changed what I look for in relationships, though, because a lot of those friendships I had before, it turned out we had super different values around COVID. Um, and somebody in the chat was talking earlier about that, like, is going to this thing worth it for me to get long COVID? And unfortunately, sometimes I've had to make that assessment of like, is having a friendship with this person worth it to me to get long COVID? Sometimes we can be creative and we can see each other over Zoom, or we can, watch a show together virtually or be outside in masks. There are options. But it's really steered me toward looking for people in more one-on-one connections who are doing this because they care about it and are not just accommodating me. Um, and I'm really grateful to have found some of those people.
Thank you. Um, I I am thinking a lot about this like idea of abandonment too. The 4 Hour Long podcast had a fancy term for it, which I forget what it was, but like we see how folks get abandoned in our society, and especially people with disabilities and people who are more COVID cautious. And and so one thing we can all do is like not abandon people, right? If your friend has more cautions than you, like meet them where they are, talk to them, like hear what it is that they need so that you can think about how that works into your life. Um, and then figuring out if it isn't possible to do in person. Maybe you have to work in person and they can't see people who've been around other folks, like do virtual stuff. There's someone also talked about like recontextualizing joy in the chat, and I love that phrase. I made me think of like early in the pandemic. Most of my friends are long distance already, but then we started like reading books out loud to each other on Zoom every week. And it was like so special, and I'm so much closer to folks um, because of that. And it we could have been doing that before, but we weren't. So really just like finding those new methods of joy. Um, I also, I think like a lot of trans folks have had experiences of negotiating in relationships before, particularly if, we came out to people or are, not 100% perceived as our actual gender all the time. Like we have the experience of correcting people on our gender, or telling people our new names or whatever it is. And I found the experience of like being weird looking to be super helpful. I was like, and I mean, this is privilege, right? I'm white, so it was like way safer to be weird looking. But like, I'm used to people staring at me at the grocery store, so like, it is no problem for me to wear a mask at the grocery store now because people were gonna stare at me either way. And it like kind of brings me some humor in my like relationships. And I'm hopping around because I have a list of like what I was gonna say, but then the chat's so much more interesting than what I was gonna say. So people were talking about like dating and relationships. And again, that's just like such another place where we get this chance to be really specific. And I saw some folks have already given this advice, so I'm just like stealing from you. Thank you in advance. Of putting it in your dating profiles, like spelling out what you mean and asking people what they do, and like what a cool chance to like express ourselves and set our boundaries. And like a lot of people are not going to be up for it. And so what a cool chance to like get better at rejection, I guess. um, to frame it positively. There's not a simple solution, but I I do think that's been really awesome. And then when you do find people, there's sometimes you can find like you have shared other values, like finding people who have shared ideas around COVID with me. Like often we share other ideas, like people shouldn't get sick and like die because their government neglects them. Like most COVID cautious people are kind of like, yeah, maybe the government shouldn't abandon people. Um, and that's cool because that's one of my values. Um, so that I think that's been really helpful too of like finding those cross connections. And I know there's like an app for specific like COVID cautious community. Um, that's sort of like a meet people app, but not a ton of people on it. And then there's like a ton, yes, refresh connections. And then there's like a ton of discords and other groups too that I think a lot of people are doing. And the other thing I saw in the chat that I loved also was kind of thinking about like what's shameful, what we've been told to be ashamed of or stigmatized, like online relationships or being isolated or things like that. Um, to really like find the tools and support we need to unpack that shame because like online relationships are great and your COVID precautions are great. And if people are telling you you're not like having enough joy in your life, like it, that doesn't need to add to the shame. That's something we can like, we can assess and decide if there's someone whose input we trust or not. But like, you don't need to take that. And maybe you do have enough joy in your life. It's just not what it looks like to them. Um, that's I'm the one who's taken us off topic, it looks like. Just
Well,
placing bets on who it would be.
Emil, can I jump in for a sec?
Yes.
I was going to talk about this later, but it's so perfect here that this, like, building relationships and the language of like breaking isolation is something that puts the burden so much on people who are more at risk and who are taking precautions to protect ourselves. And it also assumes that connection and relationships look a certain way, that it's like it should be offline, it should be face to face. You probably shouldn't wear masks because that gets in the way of connections. And these ideas about like what is valued in relationships when that's going to look really different for all of us. And I don't want to devalue or take away from the really creative ways that we are meeting our needs for connection. And so many people are sharing that in the chat. Um, so I just wanted to add that in there.
Um, so our plan next question was kind of around boundaries and identifying what we need. And yeah, I think I can just start with a little bit about what I said about like just already being weird looking is, I was brought up in a like white middle class conflict adverse culture that is like, don't rock the boat, go along, make everybody happy. And like being trans has led me to unpack a lot of that because like, getting folks to use they, them does not like make all the people happy, makes me happy. I think it makes everybody on this webinar happy that I use it. I'll use whatever you want. And so like already I've sort of had to do some of that work around like being willing to engage in conflict and disagreement and like set boundaries and rock the boat. But noticing in myself where I'm tempted to just like go with what's easier. Um, and and then take a step back from that and be like, no, I do have this boundary. Has been really important part of setting boundaries for me. Um, Caleb or Michael, do you have some stuff about boundaries you want to add?
It every time you said the word boundary, with a great word. I love that word. And every time I hear it, some days, I'm like, well, that's just having good, solid communication. It's just stating your needs. It's listening to what somebody else needs. So I just wanted to put out there that I think sometimes people get hung up on the word boundary, and it doesn't have to mean anything other than let's have good, solid communication and listen to each other and respect each other and all that good stuff. That's my little preachy preface. One of the things that Caleb mentioned earlier was something that we as a team at Forge have had the experience of in setting boundaries or communicating our needs. And we've only been together a few times in the last 5 years. But each time that we've had either a dyad or a triad or a quadra or penta or whatever it is, number of people come together, we have initiated really early on. Hey, here's what I feel comfortable with. Here's what kind of things I'm going to be doing leading up to being in person. Here's what I'm going to do in person. How does that feel for everybody? What are you all going to do? What do we all feel comfortable with? And we've had some really beautiful conversations about what we each value, what we need, what our realities are, with different abilities to do things or not. Um, and I just think it's really, really wonderful. And I know that not everybody has that in terms of their colleagues or their friendship circle, but I just think it's really important for us to sometimes say, hey, it's really possible to have multiple people talk about this thing that sometimes is hard, sometimes it's not hard, and we can come to some agreements. And we can all bring our own selves to it. And we can still come to a place that feels good to all of us. And I know, I think we've all said before, it's like, whoever has the highest level of need, we try to all kind of come up to that. Need is not even the right word, but we all try to take the most precautions rather than the lower end if there's somebody at that higher end. So I really value that, and I really value that about our workplace. And I feel very privileged to be in that spot. So. Caleb, your thoughts?
That's really, I don't know how to follow that. That's really great. And I really want to highlight so much of what folks are sharing right now about what is a boundary but an invitation to connect. And I'm sorry if somebody else already responded to that, but it feels so true that I love it so much when I'm connecting with people who are also COVID cautious, and they'll tell me first, like, this is what I need to feel comfortable. And I'm like, amazing. I love that. Even if it's not exactly the same as what I would do normally, I'm like, thank you for like inviting me to do that so we can be safely together. Because I think so much of the time it's the people who are um more cautious. I'm very used to being the one who has to ask for what feels like a lot, even though it's not too much to want to be safe. Um, that reciprocal communication means so much to me.
Yeah. Um, I keep getting caught up in the chat. So good. I'm just gonna sign off and like join the chat. Okay. Oh, um, yeah, I was thinking about like that connection and those negotiations. And some of the stuff we were thinking about is like what happens when somebody can't do what I ask. And and coming up with other options was part of it. It might be like I'm gonna say no, we're not gonna hang out. But also, doing other things, hang out virtually, go to a different event, like watch the same TV show from your separate houses instead of together, move things outside, don't eat while you're there. Like whatever these different things are, there are ways that we can adapt and maybe make things safer. And again, like connecting back to this lens of trauma, like one thing that trauma really impacts is our sense of agency, like our sense of being able to control what happens to us and the world around us, because things are taken out of our control, right? That makes perfect sense that that's impacted. And there's a lot about COVID that we don't control. And the places where we can feel like we have some control, like we have some agency, can be really, really healing and empowering, and increase our just our well-being overall. just the feeling like I do have some choices and I'm making a conscious choice can be really good for you. And so that might be, I have a choice here, and my choice is like, no, I'm not your friend anymore. Or I have a choice here, and my choice is that we are telephone friends. Um, my choice is that like I spend time with people I love outside. I live somewhere where it's like it's always outside weather, so I forget that y'all don't always have outside weather. And so yeah, I think that really honoring the ways that we've had so many choices taken away from us and finding ways to have choice. It's not like silver lining, it's not erasing all of the bad stuff, but it can be healing. And it can help us just like feel those connections some more. So I wanted to bring that piece into it. Um, let's let's see, we've got 13 minutes left. Let's talk about meeting our needs for connection. That's been a big theme already, but what are some of the ways y'all in the chat and y'all, Michael and Caleb and me, how are we meeting our needs for connection?
Emil, I wanted to pick up off of something that you said earlier, which I think it was you that said it. And many people in the chat have talked about polyamory. I don't think I saw BDSM, but like sometimes we do make risks that we wouldn't normally want to do in our everyday life, but we have a need sometimes, whether it's for touch or sex or connection or whatever it is that we may want to make a deviation from our normal practices. Um, and for me, I need to normalize that. Not that I'm one that does that a lot, that kind of deviates from my um, COVID cautious practices, but like I think we have to recognize that we're human. And so when I think about, our need for connection, um, that's part of the equation in my head. And I really need to remember that about other people too. It's like, can we have some compassion for people's emotional needs, which sometimes might mean doing riskier things than others. Yeah, I don't know where that takes us, but I think it's worth saying. And there shouldn't be shame around that or stigma around that. Other people may want to make different choices around us if we take risks, but that's just the reality for some folks that really have an emotional need to do something that violates those traditional cautions that people take.
And I love it. People are saying yes to that and talking about, masked BDSM nights, masked one-on-one or one on multiple number of people, sexual activities, and like, yeah, making it fun. Like whether it's sex or dating or board games or reading books out loud, like we can we can have masking be fun or whatever the precautions are. 6 feet away and outside uh, can add some fun to it too, and just finding ways to like have that be safe. Caleb.
I also just wanted, somebody shared in the chat a reference to an earlier comment talking about giving myself some grace when I choose alternative choices / harm reduction. And I think that relates a lot to Michael, what you're sharing around like sometimes we are choosing something that has more risk for like other to meet other needs, and giving ourselves grace, I think, for like the imperfection of that, or like because that there isn't going to be a perfect no risk. There are higher and lower risk things we can do, but keeping harm reduction in mind in those scenarios, I think, is really helpful.
Um, I'm seeing some love for the health departments that had their sex positive COVID protocol early on in the pandemic. We're not getting as much of that anymore. Yeah, I think it's like shame can also be really connected to trauma and like our experiences of it, and being able to unpack the difference between like guilt, which is often about our behavior. And so I might feel guilty and be like, oh, that's a sign I don't feel good about a decision I made and I want to make different decisions in the future. Um, but shame is like that feeling of like I'm bad, and that's it's probably like not helpful. Very few people like grow and change and learn from a shame spiral. And it feels terrible. And often comes from a place that's like not true. So being able to unpack that and give ourselves that grace around, you know, what is harm reduction? What are the choices I'm making? And how am I protecting myself or other people in the future? And maybe it's like, yeah, I take this risk and then I'm not around people for a little while. Like I do less afterwards. We go back to that layering. Um, I also feel like I don't think we've brought up like there can be a lot of us have been taught maybe from purity culture, maybe from all this stuff like that teaches the person who is sick that they are like bad and did something wrong. And like we see that with STIs of like people calling them dirty. Um, and it's like, you're not clean. You had negative HI, like negative STI tests. And if you've had sex since you had that test, or even a few weeks before that test, like that test might not have even been right. So like clear, let's take away these stigmatizing words, but I have seen some of that stigma too come around like blaming an individual who catches COVID, and it's like you don't even know always where you got it. Sometimes but you don't always know. And how can we like take that all that work that like comes from histories of like trans and queer movements of destigmatizing our health that like happened with the AIDS movement and apply that to COVID, where we are giving ourselves grace while we are also really deeply caring for each other. And y'all have said some amazing stuff about just how, like in the chat, how much COVID cautiousness is an act of caring for other people, not just ourselves, but like the people we're around. Um, so I think there's like pieces there to explore too. And yeah, also realizing how much like we have been let down by like every institution and government ever. Like we could have had paid leave, we could have had universal health care, we could have air filtration in every like government building and school, we could have all of these nice things, but the government doesn't want us to. They want war and bombs. Um, and so really being able to place the blame where the blame needs to be, I think has been really important. And that our ability to like do that can be impacted by trauma, and like everything can be impacted by trauma. That's Michael. It's not my
Well,
ramble.
no, building off of it though, it's like I've been thinking a lot lately about, since a few months ago when we had a change in the administration. Um, a lot of us are worried about the connections that we try to make or we want to make. And I think another layer of trauma for some people is like, okay, we want to move off of Facebook or we want to move off of whatever platform. And how do we do so? How do we find a place that's safe so that we're not going to get doxxed? We're not going to get harassed by anti-trans haters. How do we protect ourselves in that way, in the trauma way, in the like not being targeted because of our transness? So we've got like that piece now. Well, it's always been there, but it's really, really high now with COVID things, with there's just a whole bunch of different things, and different people are doing different things about it. And I've watched a couple of things unfold where like I wanted to be involved with something, and people are like, oh, in order to join this, this signal chat or whatever, you have to show up in person, which I'm like, I don't do that. I don't want to do that around for COVID reasons. I don't want to drive, 45 minutes away. All of those things which create a barrier. Like, but they're doing it for a reason. They're doing it because of the concern that they have for the trans part of it, the doxing, the protecting a space. And so it's kind of like there's this weighing of like, what do we do around COVID caution? What do we do around trans harm caution? And how do we find some places that we can get people's needs met? And I don't think that there's an answer to it, but I think that the more that our our world is so anti-trans right now, I think we're going to have to find some really unique strategies. And we add COVID into that and all of that. So it's no answers there, but just another set of challenges that I'm seeing a lot. Kayla, what do you think about stuff?
I've been
Before you go, if anybody has a like, what's the final question you want us to answer, please put it in the chat now because we're close. Okay.
I don't know that I have something to add here because I've been noting a lot of these comments around like how do we encourage our trans and queer communities to like make precautions part of these spaces. Um, and I am seeing folks also share experiences and resources around emailing organizers and requesting those kinds of precautions. I see somebody recommending the Death Panel podcast, which it sounds like, Emil, that's what you were talking about too. I'm trying to capture as many of these as possible so we can share them back out with you because these are some really fantastic suggestions.
Yeah, we'll definitely update our resource list. And I heard folks talking earlier about ways to stay connected, and we'll chat about that. But if you have specific asks for us, feel free to share them in the evaluation also, which you'll get when you close this, and we'll send you the link. Because yeah, we're, as you can see, a small team, but also we get so much out of this, and support for trans survivors is a huge part of our work. So thank you all. I see a couple, this might be a quick, good question to end on. Yes, you can sign up for the Forge email list on our website. And are we doing this again? I don't know, but I love it. We're hosting a book discussion group, which is totally different, in a few weeks. And then the last question I'll pull up is, what are the best ways to actually communicate COVID boundaries that y'all found that don't further create argument? I act like that's a short question. That's not a short question, but um, it really depends on the person. There are, I think, people who like are gonna argue no matter what. That's their style and personality. If there's someone I'm in close relationship with and I know that, I can, talk through what their arguments are, or like try to understand where those arguments are coming from. If it's not like a hostile place, but I don't have access to the same information as you kind of place, that, I will talk with them further. Recognizing that people don't have the same information I have, people who are out there just reading mainstream newspapers have a totally different set of information. And then, great, we're seeing some tips in the chat, but I think also just me knowing what I want and being clear and specific and repeating it. It has been like the most helpful thing to me. And repeat it in writing, well in advance, right before a thing, at a thing, repeat it out loud over and over. Awesome. Thank you all for sharing info. Do either Michael or Caleb, do you have anything to add, or another final question?
Well, I know some people are going to start dropping off. I am so grateful to everybody that was here today. This is just, I'm excited to read the chat because I couldn't read it all at the same time. But thank you very, very much for showing up and contributing. And all of these resources are just amazing, really amazing.
And I feel the same. I'm so grateful to all of you for being here. I saw somebody comment earlier about how important it is to be around other COVID cautious people who just get it. And I'm like, being able to vent about how uncomfortable masks are without it being about why we stopped wearing masks is so liberating. That's a small example, but you all have shared so much, and I think have provided even more information than we have. So that it's really amazing. You all like know so much about this and bring so much knowledge, and I'm really grateful.
Thank you, everyone. We'll read through the chat and follow up on things that we couldn't. And we will be sending our contact information and resources, but they're up on the screen briefly. y'all have been amazing, and I'm so grateful for the space with you. And with all of our interpreters and our team, Michael and Caleb, thank you. Everyone, please take care of yourselves and your loved ones and everybody around you. um, and we'll hopefully see you again soon. Have a good evening.